Welcome to Cancer Research Africa, and thank you so much for joining us. I'm sure you are joining us because you are interested in the intersection between the two words, cancer and Africa, and what role does research have to play in this. And I promise you, you will not be disappointed. And so in this episode, we're going to open up our conversation by focusing on the commission that was released by Lancet Oncology, which focused on cancer in sub-Saharan Africa. You see, what most people know about sub-Saharan Africa, particularly as it relates to disease, is about infection, malaria, HIV, and you mentioned it. And we know that now we talk about, COVID pandemic. But one thing that we must realize is that sub-Saharan Africa is going through a transitional phase where there is a convergence between communicable and non-communicable disease. And the chief of this non-communicable disease, as rightly been said by an author, is cancer, which is, clearly recognized as the emperor of all maladies. And it's important for us to look at the trajectory and the burden and the pattern of this disease in the sub-Saharan African continent. What is clear from evidence and data is that in the next couple of years down the line, sub-Saharan Africa is going to bear the burden of cancer when you compare it to other parts of the world. In order not to make this a kind of self-fulfilling prophecy, as it were, the Lancet has commissioned this report. And in this report, clear areas of needs, unmet needs, and areas and opportunities for intervention have been identified. And the good thing about this is that also listed areas and burdens, present, for each countries in sub-Saharan Africa region. And so in this series, we're going to be inviting scientists, clinicians, patient advocates, and bringing them on this podcast to interview them and interact with them. So our conversation is going to center on what they think could be done for their own country in order to ensure that the trajectory of cancer incidence is controlled, and we improve the quality of care and clinical outcome for cancer patients. Ultimately, we will identify how we can all work together to ensure that cancer stops being a deadly disease on the subcontinent, and rather is a disease that we begin to have, will reduce the risk, improve the quality of care, ultimately resulting in improved clinical outcomes. Also, our discussion in this series will identify the uniqueness about the sub-region. What is unique about the Black people? We know that the sub-Saharan African region is populated by Black people. And so we want to identify what are the unique features of cancer in this population and what can we do within the constraint of limited resources that we can optimize and maximize the resources available to ensure that we deliver critical care to patients that are in need of this care. So we talk about the genetics of it, the behavioral science aspect of it, what are the clinical trials that are going on and which ones can we bring on board, particularly what are the areas that we can use implementation science to begin to adapt interventions that have proven effective in other areas and domesticate it on the subcontinent. What are the social determinants of health that we can control to prevent the continuous upsurge of this disease, which actually is gradually becoming an endemic disease on the subcontinent. And so I want to implore you to engage with us, chat with us on Twitter, send us your question after every episode. If there's specific interest that you have that you want us to talk about, we want to hear from you. We are here because we want to communicate to you. We want to provide the knowledge. And so we're not going to be bringing scientists that are not working on the people of sub-Saharan African continent. We will be bringing scientists to you that are working on the continent, or those, though not residing on the continent, but are studying cancer on the subcontinent. And so our focus will be not just, yes, we look at sub-Saharan Africa as a whole, but then we will be bringing scientists from specific countries in this sub-region, ensuring that we meet the need of every country within this region. Once again, I want to welcome you. And my name is Rotimi. I'll be serving as a scientific correspondent for Cancer Research Africa. Thank you very much.